All right, so we're going to do a final exam, putting it all together for Pharmacology 1. Okay, so just pay attention to Canvas for updates about when we're going to have the exam, what time, where to be, when to be. You know all the rules by now. You better. Okay? Don't bring your phone. Wear the right stuff. If I definitely recommend going back and watching all the putting it all togethers. Um, using your S&O as well to show you where you struggled the most. Okay. So using your S&O from all your previous tests and deciding where you struggled and building off of that. Okay. So, but I'm not going to review the entire semester because I don't have 3 hours, but we will go over just some test questions. Okay. All right. So just remember you have the PowerPoint, you have your handout, and you have your lecture from Role of the Nurse and Pharmacology. So let's do a practice question. Which of the following actions are responsibilities of the nurse in pharmacotherapy? Did we assess the patient's response to the medication, administer medications without a provider's order, educate the patient about medication side effects, monitor the patient's drug interactions, prescribing medications for patients, ensuring accurate medication reconciliation, document medication administration with and patient response, or recommend over-the-counter without consulting provider. All right, so let's go by this one by one. Remember, select all to apply are just true and false. So, um, let's go over this. Should we assess the patient's response to the medication? Is that true? Absolutely. Should we administer medicines without an order? Never. Never. So that's false. So should we educate the patient about the medication side effects? Seems important. Yeah. Should we monitor for drug interactions? Yes, we should. Prescribe medications for patients? No. Ensure accurate medication reconciliation? Absolutely. Document med admin and patient response? Sounds good. Or recommend over-the-counter medications without consulting a provider? So that one's a little iffy. We can recommend medications. However, I always check first. So I wouldn't, just because that one makes me feel iffy, I am picking it. So the correct answers are A, C, D, F, G. Okay. All right. So let's go to drug action. So which of the following which of the following are principles of drug action? Which of the following principles of drug action should the nurse understand? I'm sorry. Select all that apply. Should you, so let's just do this true and false, straight down the thing. Drug action, that's the pharmacokinetics, remember all that? All right, the therapeutic effect of a drug can vary by patient. Is that true? Absolutely. All drugs have specific mechanisms of action. That is true. They do have we do know how they work, okay? We may not know like down to which receptor it works, but we have a vague idea. And they all work differently, right? Drug absorption is unaffected by the route of administration. That's false. We know that route can definitely decrease your drug absorption. We know that IV, IM are way faster than our transdermals. Okay. Drug tolerance can develop over time. True, right? We know that can happen. Tolerance isn't a bad thing, it just happens. Drugs interact with specific receptors to exert their effects. That's a kind of a vague statement. Sometimes we don't know what receptors it works to, but overall, yes, that is a true statement. That's how they work, right? The half-life of a drug determines its duration of action. That is false. Your half-life determines how long it takes to metabolize and excrete it, and when you need another dose. Duration, just how long does it last? Um, how long does the therapeutic reaction last? You could still have peak levels, but if you've used all the drug, you may not still, um, like you may still have a high half-life, right? But you may still have some of the effects. So they don't really talk to each other. That's false. Drugs have multiple effects on the body, or can have multiple effects on the body. You only have one. True. All medications require a prescription. That's false, because we know over the counter does not, right? Those keywords, all. All right, so now we have MedAdmin and drug calc. You should definitely know how to do math by now. Okay. Our MedAdmin, remember that is how the routes and things like that. Okay. Which of the following actions are important for safe medication administration? Should you check the patient's allergies before administration? Absolutely. Should you verify the medication with another nurse before giving it? False. The only medications we have to worry about are heparin and insulin. Otherwise, no, we don't have to verify. Administer the medicine even if the patient refuses it. I hope you're not committing battery. That's a no. Confirming the correct dosage and route. That seems important. Yes. Documenting the administration after the medication was administered. I could see you all overthinking that one right there and thinking, no, you don't document it after you give it. You document it before, or you document it at the same time. This is a true statement. Don't overthink it. Okay. We document it. I know it doesn't say how long after. Just it's a true statement. All right. Taking the medication from the cart while walking to the patient's room. That's probably not safe because if we drop it, if we spill it, what if someone comes up behind us and takes it? That's a false statement. Okay. Educating the patient about the medication before administration. You should definitely do that. Performing hand hygiene while preparing, before preparing medications. Yeah, that's definitely true. So the correct answers are A, D, E, G, and H. All right, so A and S. This is where a lot of people struggled. Go back and study. You should definitely know these. We've talked about them in all different forms now. Okay. So, which of the following should the nurse monitor when caring for a patient receiving an alpha 1 agonists? Alpha 1 agonists, that is fight or flight. So, what should we monitor? Should we monitor heart rate and rhythm? Yes, we should. Should we monitor blood pressure? Sure thing. Respiratory rate? Nope. Urinary output? Yes, because we can have that urinary retention. Okay. Gotta make sure we have all this stuff. Um, Skin condition? Nope. Level of consciousness? Nope. GI function? Maybe, right? Because we're gonna have that constipation. And then lab values like electrolytes. No, we're not. We're worried about blood pressure, heart rate mainly, okay? Then constipation and urine, decreased urine output, right? So we know that we can have tachycardia, sorry, hypertension. Just know that. All right. So perfusion. We've already done perfusion. Let's give me 2 seconds. All right. So we have our PowerPoint, our lecture, and now we have a drug cabinet. This is pretty much going to be on all of the rest of them. So let's do the test question. Which of the following assessments should the nurse perform while caring for a patient on lisinopril? Select all that apply. Should we monitor blood pressure and heart rate? We do not have to monitor heart rate. So that is not true. Lisinopril, ACE inhibitor. Okay. Should we assess the signs for orthostatic hypotension? Definitely, because it's a blood pressure medicine. Should we evaluate electrolyte levels? Yes, we should, specifically potassium, right? Check for peripheral edema. No. Monitor blood glucose levels. No. Assess renal function. Definitely, because that's where it works, right? Document the patient compliance with medication. Seems good enough. Or observe for signs of depression. No, don't need to worry about that. So the correct answers are B, C, F, and G. Okay. All right. So now we have what of the following should the nurse monitor for a patient receiving metformin? This is metabolism. Remember, this is the hyperthyroidism. This is insulin and our oral anti-diabetics. Okay. So should we monitor glucose levels? Absolutely, we should. Should we monitor our A1C? Yes, we should. Signs of hypoglycemia? Yes. Weight changes? So metformin can cause weight gain or weight loss. So yes, we can monitor for weight changes. Monitor their blood pressure? No. Monitor skin integrity. So that one's a little tricky. I'm gonna go with no because metformin does not have we were talking about metformin. We know diabetic patients need to monitor skin integrity because they're at risk for altered healing and things like that. But for person taking metformin specific, like about metformin, that has nothing to do with it. Okay. Should we monitor renal function? Yes, we should, because we know chronic kidney disease is a big contraindication. Should we monitor liver disease? That's a yes and no too, because we know that if our liver doesn't work, we can have a buildup of metformin and become toxic. But for metformin specifically, I don't remember it being hepatotoxic. If I'm wrong, I'm wrong, but I don't remember it being hepatotoxic. So I'm going to say no. And if I'm wrong, let me know. A, B, C, D, and G were the correct answers. All right, so now we have oxygenation. Remember, this is like our asthma patients, our antihistamines, things like that. Okay, go back and review. All right, you're caring for a patient taking albuterols. What assessment should the nurse perform? Should we um assess their lung auscultation? Should we listen to their lungs? I would definitely do that. Peak flow readings. Now, you may not know what that is, but that is something we monitor for someone who has asthma. That tells me how well that you're actually moving air. We use that for like someone who's got chronic asthma. Should we measure their oxygen? Yes. Rate and effort of a respiratory rate and effort? Definitely. Signs of dehydration? No. Assessment for trigger factors? No, I wouldn't do that either because I mean, actually, yeah, let's do it because if we don't want them to start having an asthma attack. So yeah, let's do it. Weight changes and level of consciousness. No. We know albuterol causes like tachycardia, insomnia, um, increased alertness, level of consciousness. We don't really need to monitor on this one because it doesn't cause drowsiness. Okay, we're not worried about them not waking up. So A, B, C, D, and F. All right, so now we have sensory perception. Remember, this is our glaucoma drugs, our eye exams, things like that. Okay, so our timolol. Which of the following assessments should the nurse perform for a patient receiving timolol or glaucoma? Should you do visual acuity tests? Maybe, right? We like it, but that's not my favorite. I wouldn't pick it. Would you check their intraocular pressure? Yes. Would you assess for systemic side effects? Yes. This is a beta blocker. If it becomes systemic, we're gonna have bradycardia, hypotension. Should you check to see if they're adhering to the regimen? I would, right? Because we know that if they stop timolol abruptly, we can have issues. The pupil response, that doesn't happen. We don't have a pupil response with timolol. Okay, signs of an eye irritation? Definitely. We like that one because we know that all of our eye drops cause eye irritation. Peripheral vision testing. I would definitely do that one because that's glaucoma. Is it getting worse? Is it getting better? Better, right? Over visual acuity. Should we get their color vision testing? No, that has nothing to do with glaucoma or timolol. Okay, so the correct answers are B, C, D, F, G. All right, so now we have inflammation. So our patient is taking an NSAID. What assessment should the nurse perform? Should we monitor for their pain? Yeah, because it's a lot of times what they take it for. I'd monitor the pain. Assess for GI symptoms? Definitely, because we know NSAIDs eat your stomach. Evaluate renal function? Definitely, because we know they kill your kidneys, right? Signs of infection? Not a good one for NSAIDs, so that's false. We know that corticosteroids, we definitely need to check for signs of infection, right? Monitor vital signs? No, because this doesn't affect our vital signs. Observe signs for fluid retention? Nope. Once again, that's corticosteroids, right? Evaluate lab values like liver function. Um, if it didn't say liver function behind it, I would say yes, because we do want to monitor like our renal function, right? But it says, for example, like is talking about the liver. No, this does not hurt your liver. Document the patient's activity level. I like it enough. It's not a horrible question. I mean, a horrible answer if you picked it. Because we want to know if the inflammation is better. That's going to tell us, are we able to move our joints? Is the pain better? Things like that. So I would pick it. So A, B, C, and H is what we're going to go with. All right, intracranial regulation. So these are our opioids and our agonists and antagonists, right? All right, so intracranial regulation. So when caring for a patient receiving opioid medications, which assessment should the nurse conduct? Should you check their respiratory rate and depth? Definitely. Should we check their pain assessment? Yes. Their level of sedation? Yes. Their bowel function? Yes. Their blood pressure? Yes. Their urinary output? No. Their skin conditions? No. And their mental status? We're going to say yes. That goes along with level of sedation. That's like their level of consciousness. Okay. So A, B, C, D, E, and H. So we know with respiratory rate and depth because we don't want that respiratory depression. The whole point of a pain medicine is to relieve your pain. We worry about level of sedation and mental status to see if they're drowsy, if they're awake. Do I need to give them Narcan, right? Their bowel function because we know opioids cause constipation, and their blood pressure because we know opioids can cause hypotension and orthostatic hypotension. Okay, so those are the correct answers. All right, now we have infection. So we have a patient receiving vancomycin. What assessment is essential? Should we measure their temperature? No. I mean, honestly, I would pick it and not, that would be an iffy one because yeah, they have an infection, but their temperature, I mean, it will get better with they taking anti-infective. So I say go for it. Okay. Assess for signs of allergic reaction, especially if it's their first time. Yeah, let's do that. Monitor lab values. Um, we're gonna just pretend it doesn't. If it doesn't, this white blood cell count, we definitely want to monitor, right? We also want to monitor if we know if it's a vancomycin, we want to monitor our kidney function. Okay. So definitely like that one. Evaluating the renal and hepatic function. So that statement is only half correct. We don't monitor liver function with vancomycin. So that is wrong. That is incorrect. Observe signs for superinfection. Yeah, definitely want to do that. Superinfections or opportunistic infections, we definitely want to monitor for that. Assessing hydration status. That one, I wouldn't do. Vancomycin doesn't cause you to be dehydrated. We do want them to increase their fluids because we know it can, hurt their liver, but we aren't checking hydration status like their skin turgor, okay? Or how well they're peeing, like the urine specific gravity, which is what that's talking about. So no, let's not do that. Check for medication adherence. Definitely for this one because we know our antibiotics, if we stop them, we don't like that. You gotta take it like you're supposed to. Document the history of infection. No, that's not really important, right? We don't care if you had an ear infection when you were 2. Right now, you have septicemia and you're 45, right? I don't care your history of infections. Maybe the history of this infection, but that says of infections. That's all of them. So let's not do that. All right, immunity. So immunity, no, make sure you know that lovely little chart. Know your 7 rules for your CDC, and you're paying attention to that, okay? There's not a drug cabinet, but the chart and the 7 rules, know them, okay? Which assessments are important for a nurse to perform while administering a vaccine to an adult? Should you review the patient's immunization history? Yeah, you should, because you don't want to double give them a live vaccine because they would need it, right? Assess for contraindications and allergies. Definitely. Monitor for adverse reactions post-vaccine. Yep, let's do that. Evaluate the patient's understanding of the vaccine. Yeah, they definitely need to know what they're taking before you give it to them. Check vitals before administration. I say do it because we need to see if they have a temperature. Because if they have a fever, they can't get it. Document the patient's vaccinations and the patient record. Absolutely. Observe it for injection site reactions. Okay, this is a bad question because it is all of them. Or you should definitely observe for injection site reactions, right? We should assess for previous vaccination side effects too, because if they have a true allergy, we're not going to do it. Sorry about that. It's all of them. Never going to happen on the test. All right, elimination. So now we have a drug cabinet, okay? We have our peptic ulcer, our peptic disease medications, and we have our constipation, antidiarrheals, antiemetics, and IBS, okay? When caring for a patient prescribed a proton pump inhibitor, what assessments and considerations should the nurse prioritize? Select all that applies. Should you monitor for signs of GI bleeds? I'm gonna say no. Um, the way I read this is monitor for signs of GI bleed. It's not assessing their current GI bleed. It's not assessing for, worsening GI bleed. This means when I read this, monitor for signs of GI bleed, to me that means the PPI is causing it, and PPIs do not cause it, they fix it. So no, not A. Assess the patient for hypomagnesia. No, they cause hypocalcemia and osteoporosis. Okay. Evaluate the patient's medication adherence. Definitely want to do that, always, right? Monitor for patients for the potential of drug interactions, particularly clopidogrel, which is an anticoagulant. No, because PPIs do not have an interaction with blood thinners. Okay. Assess for changes in bone density or osteoporosis risk. Yeah, we just said it can cause that, right? Evaluate the patient's understanding of the importance of taking a PPI before a meal. No. When do you take a PPI? On an empty stomach, 20 to 30 minutes before your first meal only. Okay. Monitor for signs of liver dysfunction. PPIs don't hurt your liver. I think they hurt kidneys. And no, it's not your liver. So no, the only correct answers are C and F. All right, so now we have sexuality. Sexuality is new for the final, okay? Make sure you go look at your blueprint if you want to see how many questions are going to be on sexuality. So we're going to do this little lovely question, and then we'll go over like a little concept map. It's very short, okay? Um, when caring for a patient undergoing hormone replacement for menopause, which assessment should you perform? Should you monitor your vital signs? Nah. I mean, these don't affect our vital signs. Okay. Would you monitor for signs for a clot? Yeah. Should you evaluate for mood changes? Yes, because that's what menopause is. And if you start taking estrogen, they will go away. We need to check them. Should we check our lipid levels? Nope. Should we assess for bone density? Yeah, because we know that they're at more risk for a fracture. Okay. Document the patient's menstrual history. No, they're in menopause. They don't have a menstrual history. They're done. A monitor for weight changes. That can happen. You can gain or lose weight with the estrogen therapy. So definitely have that one. Observe for breast tenderness. That is also a side effect. It's estrogen. Estrogen makes your boobs hurt. All right, so we have sexuality. We have our estrogen therapies. Guess what they all have in it? Some kind of estra or estrogen. Okay, so our biggest side effects here are clots. DVT, so it's going to look like calf pain and redness. PE, that's shortness of breath. Our MIs, chest pain and shortness. So, and then our stroke, which is going to be the facial paralysis, altered speech, ataxia, that kind of stuff. Those are real. They will happen. Okay. You're also at your increased risk for cancer, specifically female reproductive cancer, like breast cancer, cervical cancer, ovarian, uterine, whatever it is. This does decrease the risk of hip fractures. I'm sorry, and I said that it does increase it over there, but we still want to measure someone's bone density to make sure that it's helping. Okay. Um, and it can also increase your risk of dementia. All right, and then we have our two other medications, the aspifinin and the progesterone. These help increase their estrogen therapy, so you still have all the estrogen possible side effects, but this will help with like increased lubrication and help decrease the pain with sex. That's really all there is. Okay. All right. So, oh, yeah. So if your patient already has cancer or has already like has one of these problems, has a heart problem, has cancer, they're not taking these. Okay. Just for up here. Okay. All right. So we have nutrition. So when caring for a patient receiving vitamin A therapy, what assessment should the nurse prioritize? All right. So, should we monitor for hypervitaminosis A? I would because that's overdose. You can overdose on vitamin A, right? Assess vision changes, particularly night vision. Not for vitamin A. I think that'd be a vitamin E. Okay. Should you assess liver function? Yes, because we know that vitamin A overdose looks like liver dysfunction. Check for skin changes and dryness. Yes, because that's what it does. It dries out your skin. Monitoring dietary intake of vitamin A. We should definitely do that because you don't want to overdose. Assess the signs for symptoms of fat malabsorption. No. Document the patient's medical history, including other fat-soluble vitamins. I mean, doesn't sound bad, but I don't think that's really a priority for vitamin A. Evaluate the patient's understanding of the importance of vitamin A in their diet. We're not doing that one either because I don't want them to overdose. All right, so let's go over our vitamins. Sorry, my computer is slow. All right, so vitamin A. This is what we use it for acne. Vitamin D, we use it for vitamin D deficiency, calcium. Vitamin E is for immune health, and vitamin K you need for clotting. Okay, so if I had this will make you clot more. This is boosts your immune system, helps with calcium, dries out your skin for acne. So overdose looks like alopecia, nausea, vomiting, diarrhea, liver, and it is a teratogenic. You cannot be pregnant or get pregnant while taking vitamin A. If you have excess vitamin D, you're going to look like a hypercalcemia. Okay. If you have excess vitamin E, you'll have vision changes. An excess of vitamin K, if it helps you clot more, guess what you're going to have? Dyspnea because you're going to have a PE. Okay. Hypotension can happen as well. So then we have our water soluble vitamins. We have thiamine, that's for immune health. Riboflavin helps you metabolize carbs better. Niacin decreases your cholesterol and your blood sugar. Pyroxidine is used for anemia and what's it called? Pregnancy-induced vomiting. I'm sorry. Thiamine, so we use it for alcohol abuse. It helps protect your brain from the alcohol abuse. The riboflavin increases your energy because it metabolizes carbs better. So niacin, make sure that you monitor liver function because it can hurt your liver. Folic acid, you have to take this when you're pregnant because it helps with brain development of the fetus. So super important. Cyanobalamin, that is vitamin B12, that increases your energy, and if you have too much, you may clot. And then vitamin C, ascorbic acid, that is immune health. We've all taken a vitamin C, okay? And then we have our electrolyte salts. So guess what you have? If you take too much sodium, guess what you have? Increased sodium. So we got to monitor sodium, we got to monitor water. Potassium, increased potassium, monitor your heart. Calcium, monitor for kidney stones and hypercalcemia. Magnesium, decreased tendon reflexes, increased mag. Phosphorus, increased mag. Straightforward, okay? Iron we use it for replacement of iron if you're anemic. Constipation, black stools, and if you take too much, it will hurt your liver, okay? And then zinc we use for increased healing. It's really all we use it for. All right, you are going to do way better than you think you are. You prepared. Go study. Go watch those putting it all together that we did in the past, okay? They will help refresh your brain quickly. All right, use your S&O. Let me know if you have questions.